Let's go live right now to Queen's Park, where Liberal leader Bonnie Crombie and health critic Adil Shamji are discussing healthcare in rural Ontario.
And healthcare workers are leaving the profession or their jobs in hospitals because of the strain they're under as a result of the cuts. Staffing shortages are pushing municipalities to the brink of financial disaster as they turn to overpriced, temporary staffing agencies, and hospitals are wasting hundreds of millions of dollars that should instead be spent on new diagnostic equipment or clearing the surgical backlog. I heard firsthand troubling stories from mayors having to fight for their hospital, only to see closures, or councillors desperate to attract family doctors to their towns, who are being ignored by this government. This morning, we just learned that 10,000 patients in Sault Ste. Marie have lost access to their primary care provider, all in one fell swoop. The government knew about this and failed to act. That's why today Ontario Liberals are joining our municipalities to demand that the Ford government take urgent action to support healthcare in rural and northern Ontario. And now, I'll turn it over to Dr. Shamji to share more about our efforts to be the strong partner that rural Ontario deserves. Thank you.
Thank you. Bonjour tout le monde. Good morning, everyone. If there's one thing that I learned in my many years working as a family and emergency doctor in rural and remote communities here in Ontario, it is that when our healthcare system starts to falter, it is felt first in these northern, rural, and remote communities. And after meeting with so many municipalities this week, rural municipalities at Roma, I can say for certain that this fact remains the case. Rural healthcare is in crisis. Rampant ER closures, staffing shortages, and no access to primary care. As we learned just this very morning, 10,000 patients in Sault Ste. Marie will be notified today that by the end of May, they will no longer have a family doctor. Our sources are telling us that this family clinic reached out for help to the Ford government and got nothing in return. Doug Ford's indifference, inaction, and incompetence is actively making healthcare worse, and we can certainly say that to the people in Sault Ste. Marie. He never gives rural municipalities a seat at the table. When we fought to give them a seat at the table, when this government tried to introduce their healthcare legislation, like Bill 60 for out-of-hospital surgeries, or Bill 135 for a remodeled home care system, I pushed to get northern and rural and Indigenous communities to be able to have a say in those things. And Doug Ford and his government said no. He refuses to help build hospitals, even when local communities come up with their full local share. He won't help regulate or rein in temporary nursing agencies. This Monday, we learned that the town of Bracebridge's municipal levy, 5% of that goes to temporary nursing agencies when it could go to repairing infrastructure, helping with bridges, helping with homelessness. And Doug Ford offers no help on mental health issues, opioid supports, or supportive housing. And so today we're here to say it's time to tell rural municipalities that you matter. We are therefore calling for urgent action to support rural communities and rural healthcare. We are demanding that Doug Ford respond to all of the recommendations in the Auditor General report on northern hospitals, as well as the recommendations that came out of the Roma Conference on supporting rural healthcare. And there are two very important reports there with extensive, concrete recommendations for Doug Ford to follow. We want rural municipalities to have a seat at the table, a seat at the Ontario health teams, so that they can have a say on their own healthcare decisions. We are calling on Doug Ford to regulate and rein in temporary staffing agencies, and we want to maximize health human resource support and staffing in the north for primary care, long-term care, and home care. I'd like to say that Sault Ste. Marie is a canary in the coal mine, but it simply isn't. We had the Minden ER closure a few months ago, thousands of hours of ER closures, and this needs to stop now. With that, we'll take your questions.
Well done.
Getting doctors is not an easy thing. You can't just snap your fingers. So what could practically be done right now, or what could have been done to offset this or prevent this?
I'll pass it off to you, Dr. Shamji. So, there are a number of things that need to be done from an investment standpoint. Right now, we know that over $185 million is being used on outside agencies rather than being invested in those hospitals. Some hospitals, the cost of outside agencies is $2 million, as high as $8 million that I've been reading. So that money could go into diagnostic equipment. It could go into clearing the surgical backlog. But at the same time, it needs to go investing in our healthcare workers. And so paying them a proper wage and attracting them and providing them the incentives. And I know Dr. Shamji has a plan, but I know it also includes a new medical school in the north, and perhaps providing free tuition that they could pay off over years with a multi-year service agreement. There are many ways we can continue to attract quality healthcare workers to our northern and rural communities. Dr. Shamji, would you like to elaborate further? Thank you.
Well, specifically as it relates to primary care, there are so many things that could be done. Number one, we need to maximize incentives to attract primary care practitioners to northern, rural, and remote areas. We need to train more of them in those areas as well. And I don't just mean having a medical school in the north. They need to, our medical schools need to be funded so that medical students, nurse practitioners can train in the communities that hopefully they will one day be able to settle in. And at a time when this government consistently underspends by billions of dollars, financial quarter after financial quarter, wastes hundreds of millions of dollars on temporary nursing agencies, when a clinic like the one in Sault Ste. Marie says that we need help and funding to keep our doors open, the government needs to say yes. And the only way that this government ever says yes is if it's to Doug Ford's friends.
Do you happen to know what specifically this clinic in the Sault?
We've been listening to Liberal leader
know
alongside
specifically
health
what
critic
the
Adil
diaspora- my
Shamji
understanding is that
discussing
diaspora
health care
administrative
in
support
rural
at minimum.
Ontario, talking about some of the recommendations to make things better and taking a few shots at the Premier as well.